Turning our attention now to the ASX, here's Matt Birney and Bulls and Bears with the latest public company views and interviews.
Welcome to Bulls and Bears, brought to you today by reproductive biotech company Memphaysys, ASX code MEM. I'm Matt Birney and I'm joined now by the Managing Director of Memphaysys, David Ali. Hi Dave.
G'day Matt.
So, amongst other things, Memphaysys has been developing a reproductive biotechnology device known as Felix that the company says can select and separate the most viable sperm from semen samples for use in fertility treatments such as IVF. For a long period of R&D, Memphasys has just wrapped up what looks to be a very successful clinical trial for Felix that it says will springboard the company into commercial operations. Okay, Dave, we'll get to those trial results shortly, but first, how is your Felix in vitro fertilisation device different to other methods out there used for IVF? What exactly does Felix do and how's it different?
There are a few laboratory techniques out there, DGC, which is density gradient centrifugation, and swim up. However, Felix is the first electrophoretic-based sperm separation system which has been designed specifically for assisted reproductive technology. And I think you should know that unlike traditional sperm separation methods such as density gradient centrifugation and swim up, Felix actually uses a gentle electrical charge and size exclusion membranes to rapidly and efficiently isolate the highest quality sperm for use in IVF.
Okay, well tell me about this clinical trial. Let's not get to the results yet. Just tell me, without getting too scientific, exactly what was the trial testing for and how did you go about it?
Well, we have to test our Felix device against the current standard practice, which is density gradient centrifugation or swim up. Our clinical trial was a phase 3 non-inferiority study which compared embryo utilisation between the most commonly used techniques, that being DGC, and within the context of that trial we tested Felix against those two processes.
Okay, and what did you learn? What were the key outcomes?
Well, the key outcome I think was astounding. The Felix met its primary endpoint and demonstrated superior performance. And when I say that, our analysis of the primary endpoint showed that Felix was in fact non-inferior to swim up, which is a fantastic outcome. More importantly, and we found that statistically, Felix was actually superior to density gradient centrifugation, which is actually the most common sperm preparation technique used globally. And I think that's an outstanding outcome.
Can you now go commercial without any further restraints? And if so, where? What's the plan?
Oh, absolutely. So we're currently in the process of preparing our submission for CE mark in Europe, and that should take around 6 to a maximum of 12 months to achieve. Once we've done that, Matt, we can effectively commercialise or sell in Europe. We can then sell in Australia and move our sales into India. Having the clinical trial results, it will help us greatly because we're currently already selling in Japan where we are allowed to. But now that we've actually got the data to show that our technique is superior to currently used laboratory processes, we should be able to up our game in Japan and hopefully open up further sales.
David Ali from Memphaysys, thanks for joining me on Bulls and Bears. And remember, we're only here to give you information, not advice, which you should, of course, seek independently. I'm Matt Birney, and this is Bulls and Bears.
For more public company interviews, go to the Money page on the 6PR, 2GB, 3AW and 4BC websites and click the Public Companies tab.